Now to the spread of the Omicron subvariant BA.2 in Hong Kong. After weeks of quarantine under China's zero COVID policy, the region is loosening its COVID restrictions as cases begin to drop. Travel bans in 9 different countries will be lifted on April 1st, and residents will only need to quarantine for 7 days instead of 14 when returning from overseas. But in other parts of China, the variant continues to disrupt the lives of millions. President Xi is now taking another look at China's COVID policy, urging officials to find a way to reduce the impact of COVID on jobs. Meanwhile, the U.S. is seeing an increase in BA.2 cases. The variant now accounts for 23% of cases in the country, a sharp increase from just last week. Officials say the variant could lead to an uptick in overall cases, but officials also add there is no need to panic over international surges. NBC News medical reporter Erika Edwards joins us now for more on the latest COVID news. Erika, good morning. We've been following the rise of the BA.2 variant overseas for some time now, but Dr. Fauci now says he doesn't expect to see that kind of surge here in the U.S. First, let's take a listen.
It does have an increased transmission capability. However, when you look at the cases, they do not appear to be any more severe, and they do not appear to evade immune responses either from vaccines or prior infection. Hopefully we won't see a surge. I don't think we will. The easiest way to prevent that is to continue to get people vaccinated.
So break that down for us. Why does he believe we won't see a surge?
Hey, Zikli, good morning. So, yes, this was an interview with ABC News. He did say that that BA.2 variant is likely to become the dominant variant here in the country. We should know more tomorrow when the CDC releases new numbers there. And he did say that we should see an uptick, mainly because this new BA.2 variant is so much more transmissible, about 20 to 30% more contagious than the first Omicron variant that we had. But because we had such a huge rise in Omicron earlier this year in January, it's possible that people have some immunity, either based on that prior infection or, of course, vaccination that might offer them some protection moving forward as BA.2 becomes the more dominant strain. However, it's really unclear how long that protection lasts.
And it is important to note that nearly every state has loosened its COVID protocols as a result of COVID cases and hospitalization rates falling. And now several states are reducing their daily reporting of COVID cases also, including hospitalizations and deaths. Are health experts like yourself concerned that this move might be creating blind spots in our fight against COVID, or are there tools that can help fix those blind spots?
Sure. Well, there's about a dozen states who no longer providing those daily COVID-19 case counts, dropping back to maybe once or twice a week. But, public health officials that I've spoken with say that, perhaps it might not be worth doing all of that work, mainly because the U.S. government has sent every American those rapid at-home tests, and any positive cases coming out of those would likely not be reported to their local health department. Officials are using other metrics like wastewater to try to track real-time COVID-19 spread across the country.
And finally and quickly, Erika, you covered a new potentially rare side effect of the COVID vaccine. What impact does that side effect have? And are scientists concerned about the vaccine at all?
Yeah, so I talked with Dr. Gregory Poland. He's a globally respected vaccine expert. He's the head of the Mayo Clinic's vaccine research group. He developed a severe case of tinnitus, or ringing in the ear. Sounds like a loud whistle, about a year ago after he got his second COVID shot. Now, vaccine manufacturers and the CDC have been looking into these reports. They say that so far there's no proof that the vaccines are causing this type of illness. However, Poland says, we really need to have more research into this possible yet underreported or underrecognized potential side effect.
Erika Edwards, thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.